Hello, my hospice family. Good morning, good afternoon. Welcome back to DunsHospice. My name is Nurse Dawn, your RN Extraordinary Hospice Registered Nurse, and I shall be your hostess on this video. Thank you. Hello, all to all of my new friends, my new subscribers. I call you guys my friends, my new followers. Thank you so much for supporting this channel. This channel is for you, my caregivers. Now, if you are watching this, chances are you are caring for a loved one during one of the most tender parts of the day, which is the nighttime hours. You see, nights can feel long and lonely. They can feel quiet, heavy, and sometimes, if we're being honest, even scary. But tonight I want to talk you through a gentle nighttime hospice routine. Not just what to do, you see, but how to be during these moments. You are not doing this wrong. Please know this. And definitely you are not alone. And you don't have to rush anything. Just breathe. And here at DunsHospice, I teach us and I talk to us, the caregivers, about how to gain more knowledge regarding end of life. The more knowledge we have, the more empowerment. Okay, I give us the power to release the strength that is within us. And first of all, I want you to know some of the symptoms, okay, some of the symptoms that could manifest itself during the nighttime. Knowing these symptoms ahead of time will help you, my caregivers, to learn how to manage them. These symptoms includes increased pain or stiffness, shortness of breath, anxiety or restlessness, and even confusion or agitation. Okay? And for most families, nighttime is when emotions rise because the house is quiet, the distractions are gone, the guests are gone, you see, and reality feels louder. But know this, hospice care at night is not about fixing. Rather, it's about comfort, presence, and safety. Before touching the patient at night, I want us to prepare the environment. You see, try to dim the lights, close the curtains, lower the television, or even turn it off. Okay? And instead, use a soft bedside lamp, a night light, or candlelight lighting. You see, the nighttime environment, nighttime care should feel warm, peaceful, and grounded. It tells the body, it signals to the body and the nervous system that it is safe to rest. As I've mentioned in previous videos, hospice care focuses on comfort. So now at nighttime, we must assess comfort. You see, look at your loved one's face. Notice whether it is tense or relaxed. Are they grimacing? How are they breathing? Is it labored or is it calm? Based on your assessment, based on these factors, you should administer medications as prescribed by the hospice physician. Feel free to administer these medications without feeling fearful or guilty. And as always, if you have questions, Call your local hospice office. There's always a registered nurse. There's always a nurse who's on call, who's going to answer your questions. All right. And also, my caregivers, keep in mind that these comfort medications are not about giving up. You see, they are about relief, dignity, and peace. And also, if you are using oxygen, okay, very important for those patients with COPD, with lung cancer, okay, with emphysema, with heart disease, for those loved ones who are under oxygen management, make sure that the tubing isn't pulling. Check their nasal comfort, you see, and keep their lips moist. Another nighttime routine is in regards to hygiene care. Now, nighttime hygiene is gentle, not rushed. You see, you may clean their face with a warm cloth. Be sure to provide mouth care, apply lip balm, and change them into a fresh gown. Okay? Feel free to massage them because touch is powerful. A warm hand, okay, could mean so much, could help them to really relax. Be sure to go slowly because your presence really counts. Even when words fade, touch communicates love. Okay? Now I'd like to talk to us about safety. Safety during the nighttime. You see, make sure that before you leave, okay, before you leave their bedside, make sure to put the bed in the lowest position. Okay, my hospice caregivers, keep a call bell ready. Okay, keep the bell ready. Or those of you who may have a baby monitor, make sure that it is functioning properly. Keep the pathway clear for walking in case your loved ones are still able to use their walker to get up at night. Okay? And also make sure you are taking care of yourself. Prepare yourself, okay? Have some water nearby. Charge your phone. Have the hospice number visible because you too are allowed to rest and take care of yourself. Regarding comfort, my hospice caregivers, know that sometimes, okay, at night times, stiffness is common. You see, stiffness is common. So make sure that before you leave their room, double check the position of their bodies. Make sure that their head, shoulders, and hips are well supported. Use pillows, okay? Use pillows behind the back, under the knees, or beneath the arms. You see? If while you are repositioning them, your loved ones resist or tense up, please pause and speak softly to them. Let them know, I am here. You could tell them, you are safe. I will not let you fall. And let them know, I am not going anywhere. Because the body needs reassurance before it can relax. Relating to reassurance and a way that we can help our loved ones who's under hospice care, who's terminal ill to relax at night times is to provide them with emotional and spiritual comfort. You see, you do not need to be a pastor or a priest or, to come up with the perfect words or, to try to be an expert. A simple, I love you is plenty. You see, tell them, Thank you for everything you have done for me. Thank you for everything that you've done to me, how you've helped me in the past. Let them know it's okay to rest. All right? You can pray with them. If they are a spiritual person, definitely pray with them. You can sit quietly, all right? Before you leave the room, sit quietly with them and just sit there in the silence, in the darkness. Let the dark energy come upon you. You see, you can simply just breathe. Just breathe beside them. Just breathe next to them. Help them to do a little simple breathing exercise. Even if they don't respond, even if they cannot talk back to us, my hospice family, they can still feel you. They can still feel your energy. They can still feel your presence. All right. The spirit, the soul is still alive. And I made a video about that, a previous video. Check that out, please. All right, my hospice family. I want to make it clear, and I want us to know that you don't have to be perfect. All right. You don't have to do everything. Your presence is enough. Hospice is not about doing more. It's about being there in the present. And know that you are doing a beautiful, a fantastic job. My hospice caregivers, thank you so much for watching this video. Thank you for allowing me to walk with you through this journey. Now, if this video brought you comfort, please support by hitting the subscribe button. Subscribe to DunsHospice. Give me a like and share it. Share this video with someone who may need reassurance tonight. Know that you are doing sacred, godly work and that you are not alone. Also, my beautiful hospice family, on Amazon, there's a link in the description bar. On Amazon, I put together some equipments such as pillows, okay, bedside table. I put together a list of products that will definitely help with your nighttime routine. Check out my link on Amazon, okay? Help to support this channel, help to support me. All right. And please encourage me. I need your encouragement to continue to talk about hospice, end of life care. We know it's not a popular topic, but it is a topic. It is something that everybody will go through. Either you will be the patient, you will be the loved one who's dying, or you will find yourself in the caregiving role. Okay? So let's stay connected. Iron sharpens iron. And as always, my hospice family, I love you with the love of Jesus Christ. All right? Come back for more. Be good to yourself and each other. All right? Take care. See ya.